Hey everyone, this is Brittany.
And Don here. We're going to teach you guys today about how to set up an arterial line and manage it. We have Chester, who's starring in our production here.
First thing you're going to do is gather your supplies. So here's a picture of everything for the preparation of the placement of the arterial line. First things you're going to grab are things for sterility, so sterile gloves, blue towels, a cap, and then you're going to grab the A-line itself, the catheter, it's called a dart, a chlorhexidine prep, skin prep, some sutures, the chlorhexidine dressing, a roll of tape, and the wrist immobilizer.
Okay guys, pictured here we have our pressure cables on the right side. The upper right one is from ICU. They use a different attachment, and the one below that is our in-house pressure cable. Upper left corner is our transducer and line that we have stocked in the Omnicell in room 1. Below that is the attachment for the transducer to the IV pole. The VAMP is in the middle of the picture with a leader saline below that and a pressure bag. The tubing in the middle off to the left is what ICU uses with their unique cord. So just keep this in mind because it will likely result in us having to change the line, the tubing around, and the transducer if they go to ICU. Good. All right, everyone. So, setting up for an arterial line. It's established that we're going to set one up. It's indicated. We can't get accurate blood pressures. Patients on pressors, cardiac dysfunction, lots of indications. But we're going to, first thing, if the patient can, we're going to do a consent form. Of course, wash our hands, put our smile on, and then gather all the supplies. I'm going to have my ultrasound machine because some docs, some patient types, body types, it can be a little challenging. They may want the ultrasound.
Okay, once your stuff has been gathered, take your liter saline, take the pressure tubing, the VAMP, the transducer holder, put it on the IV pole for now. This is the pressure cable connection, which matches our pressure cable. So first thing I'm going to do is check all of my make sure all my connections are tight. Now I'm going to replace this factory stopcock, this piece. I'm going to take this off, maintain sterility of these pieces. I'm going to take the VAMP, connect it at the end. All of these are open. Transducer in the holder just to help me. Slides right in. I'm going to spike my bag. This is how I remove the air. You can also burp it. So remove air. Take your pressure bag.
What are you guys doing here?
This is Dr. Phillips. Inflate the pressure bag with the stopcock off to this port so you can inflate. You're gonna inflate the pressure bag to 300. Even though you see green, keep pumping right to that black line that says 300. And then you're gonna take this stopcock and turn it off to the pressure bag. If you leave this open, it'll leak air and then you'll deflate your bag. Okay, so now I'm gonna take now it's time to prime the tubing. So right now I've got it off to the patient. The patient is the hard pressure tubing. And I'm going to squeeze my flush line. Remove this cap so you, and that, flushing this port. Replace the cap here with one of these yellow ones. like so. Okay, turn the stopcock off to the port and continue to flush. Oh, make sure your VAMP is down, completely closed. And then I'll continue to flush and prime the line until you see the water or the saline. You're gonna take your cable, match it up. Oh, that was a lot easier than last time. And then come to your monitor, into the pressure port, turn on your monitor, and your arterial line should pop up since it's plugged in. It's obviously not going to show up reading yet because you haven't hooked it up to the patient. And that is the setup to the line. Okay, now that our arterial line has been placed by our physician, this piece, this end piece with this port is going to be connected to the patient. So once you're connected to the patient, you need to level your transducer. So right here on the IV pole, this can come up and down. You're gonna level to the phlebistatic axis on our patient. This is Chester. He's not doing well. So we're gonna level. Again, it's on the patient, mid-axillary, fourth intercostal space. So we just kind of eye it, okay? So then now to the zero. So you're going to take your stopcock here at the transducer, turn it off to Chester, which is down to the hard tubing. We're going to take off this cap, open to air, go to our monitor, press the blood pressure, 0, listen for the beep. Once the beep beeps, you've zeroed the line. Come back to your transducer, replace the cap, turn your stopcock off to the port so that you can now get a blood pressure reading.
All right, everyone. So, Chester's been in bed. We got our arterial line set up. He's smoking, so he's not doing too good. Now the doc wants an ABG, right? So we have to. The beauty of arterial lines is we can get ABGs very quickly. And so the way we do this is we gather our supplies. We get a heparinized syringe. We get these. It's a needleless adapter that's going to go onto our heparin syringe, just like so. Okay. Realize that this is not a twist-on device. It's needleless. Okay, it twists onto the syringe, but it does not twist onto our port, which is atypical of all the other lines in our facility. Okay, so we're going to take this and insert it directly into the port here. Okay, like so. This is how it works. It just goes directly in. It's the old needleless systems. Okay, now to access the blood, we have to first clamp off above the VAMP. Okay, it's not critical, but we do it just so the blood doesn't back up into the rest of our system. Clamp that off, and then we release the VAMP and pull back the blood. This will be our waste. Okay, now that the port is filled, we clamp off that waste. Take our sterile syringe and adapter, place it onto here after cleaning it with alcohol. It will just, usually the pressure is so high, and it is, as you can see. We have our simulation here. It's just backfilling into our syringe. We pull off our sample. And a big mistake, a lot of people do is they twist this off. If you twist this off, you're gonna be squirting blood all over the place. Don't do it. Remember, like I said, emphasize, pull it directly off. Okay, there's our sample. Now we open up the patient side of the VAMP. We press back in the blood, we return the blood. VAMP is locked, it clicked, and we open up our system and it will flush if necessary.